Josh, a simple checkup at your doctor's office can help prevent many different health issues like heart attack or stroke. And Baton Rouge General wants to help you. They're offering a free vascular screening tomorrow. Dr. Andrew Olin is here to talk more about it and the importance of the screening. Good morning.
Good morning, Colin.
All right, so you guys have a big event tomorrow. You guys kind of do these. What does it entail?
We have a vascular screening, and what we're trying to do is help the community identify risk for heart disease. February is National Heart Month, and also the Baton Rouge General is a major sponsor for American Heart Association's Go Red for Women. And what we're trying to do is to identify those patients that have a high risk of heart disease. We know that heart disease is the #1 killer for men and women, and so it's very important that we identify these risk factors and try to treat them.
And the risk factors are things like?
Well, some of them are smoking, diabetes, high cholesterol, obesity, inactivity, also a family history. If you have your family that has heart disease, you should be aware of that. It makes you at higher risk.
And these are all things that you can check for and look for at the screening?
What we do is we do a carotid ultrasound, which is a very non-invasive test in which we image and look at the vessels in the neck to see if there's plaque formation. And that also correlates with heart disease. We also will check blood pressures and check the BMI, which is the body mass index. It tells you whether you're overweight or you're normal weight for your size.
Is there a certain age, you hear, obviously the little older you get, the more you should, have your yearly physical or whatever it may be. Is there a younger age that you should start going?
Well, if you have a family history or if you have those risk factors, you're more prone to have this problem. In the screening, we are going to, you can look on the website the Baton Rouge General has, and we are going to select patients basically if they're over 50 years old and if they have 3 of these risk factors that make them more prone to have heart disease.
And then you guys will maybe schedule them a further doctor's visit and come in for consults, things
if necessary.
Like that?
It's like I say, it's a free screening. This is just something we're trying to help the community with. And yes, well, we can, if they find something that's abnormal, we'll certainly relay that to their physicians.
Is there things that people can be doing at home just to help, just keep them healthier than maybe what they're doing on a regular basis?
One is be active. I've got my red shoes on right now, and that just depicts that we're trying to get people out there to actively walk, do exercise, have some type of program, and that'll help you. That's very good for your heart.
Now, we hear about walking. Is there a certain, miles we should go, minutes we should go? What do you think?
I had to run to get here this morning, very early. But no, what you want to do is just get into a routine, whatever you can do. Certainly more is better if you can do it. But if you can get into a routine every day to walk a certain distance, I think it's very good for your heart.
Okay, and you guys said you had a website. The event is free tomorrow.
It is free. There's also, I think, one in February, March, and April. So
okay.
It's something.
So this is something that's available. It's tomorrow, 5:30 to 7:30. Tell us where it's located.
It's at the Baton Rouge General. It's from 5:30 to 7:30. You can get on the website to register for it, and I think it's very worthwhile for patients.
Okay. We appreciate you coming in this morning.
Thank you.
All right, and we like your red shoes. Okay. Next half hour of Tune In is...